If you're looking for a surgeon who only offers you operations, cutting you in the name of healing, risking possible complications, making you even worse, or long-term consequences, not to mention the risks of anesthesia, or a physician who wants to give you drugs rather than spending time understanding you and offering you alternatives, possibly medications, but other ways of healing, then I'm not the doc for you. But if you're looking for a doctor who wants to help you heal naturally, more effectively, avoid surgery if at all possible, relax, and take care of yourself, you're in the right place. My name's Dr. Scott Freed. I'm an orthopedic surgeon, board certified, and I've treated thousands of patients with high blood pressure, stress, anxiety, sleep problems, nerve injuries, pain, nerve pain, and helped them heal effectively, many times without surgery, with minimal or no medications. Many know me as the doctor in the house, and I'd like to share my story, our thoughts with you, in hope of helping you find a path toward taking care of you, what I call the easy way. My mission for the past 30 years has been to put myself out of business as a surgeon. I found that through understanding our own physiology, understanding how the body naturally heals itself, utilizing techniques such as relaxation techniques, meditation, devices to calm down inflammation and swelling, to calm the body's natural angry responses to injury or invasion, often allow healing in a gentler, kinder way. Healing problems such as carpal tunnel, tendinitis, tennis elbow, simply utilizing a dynamic splint mechanism, lower back, low back pain, inability to sit or stand can be helped by therapies, by these techniques, by a brace that conforms and moves with the body, allowing the muscles to still work and function and even become stronger, but yet taking care to calm down the inflammation. This is the nature of the body. It heals itself. Our body, in fact, regenerates all of its cells every 7 years. So healing is a natural process for the body. It gets rid of the bad and brings in good. The body naturally calms down inflammation, and given the right environment and overall treatment and a little tender loving care, heals and repairs itself. It does it every day. We just need to embrace that. And you and I and all of us as human beings, once we understand how to take care of the body better, can most of the time achieve healing, comfort, sleep, lack of stress, and aging in a very kind, happy way, enjoying our lives fully without any discomfort. You may ask, what brought a surgeon to preach to people not having surgery? Certainly it wasn't my training, but it was my childhood. It was my upbringing, and it was what I learned over 30 years of clinical practice, that surgery doesn't always fix people, and many times it makes them worse. As a subspecialist, I see many patients who come to me because surgery didn't work, or they are suffering even more after the surgery than before. I was raised by a clinical psychologist, and Dad, at 47, unfortunately had his first heart attack. And by the time he was 52, he had had 5 heart attacks and cardiac bypass surgery. he continued to work and move through life. And although he had these issues, you never would have known it to talk with him or to see him. But his chest pain continued and became worse. And when I was a first-year resident, he had a cardiac catheterization to see how his blood vessels were doing after the surgery. And I got a call from the radiologist, and they said, the blood vessels don't look good. So I had them send those cath tapes to me, and I brought them to one of the cardiothoracic surgeons that I knew, and we looked at them together. He turned to me and said, "Scott, I'm sorry, when did he die?" I said, "He's not dead." He goes, "That's impossible. These tapes are physiologically incompatible with life." I said, "You can call him on the phone. He's at work right now." And he looked at me in disbelief. And I, frankly, was in a bit of disbelief myself. But Dad had discovered something. As a clinical psychologist, as a person who taught relaxation techniques, in fact, brought many of these techniques back with him from the Far East during the war, he explained to me over the course of years how relaxation, how taking the body's natural resources and putting the body in a relaxed, calmer state allows the body to rejuvenate and heal. And he had actually developed new blood vessels, collateral vessels that fed his heart enough to allow him to function. Was it normal? No. But it was better than dying. And he led a normal life for 24 years after that, until he was 76 years old. And only at the end did he slow down and get to a point where the system gave way. But he lived 24 years with no cardiac blood vessels. So when I began seeing patients who weren't healing from surgeries, and even some of my patients who I operated on who weren't as better as I thought they would be, because I would talk to my patients and see them for years after surgeries, and found that surgery didn't make people normal. And medicines, drugs, often had all kinds of side effects, and sometimes actually worsened people's lives, or made it impossible, or led them to taking other drugs and medications because they couldn't survive and there were complications from the drugs or complications from the surgeries. So I began exploring other treatments, other options for people. And that is how Doctor in the House came about. I began writing books and began developing products and braces and meditation masks and different things to allow patients to heal themselves along with whatever medical treatments we deemed were necessary, allowing the patient to be in charge of their own healing, allowing the patient to take charge of their lives. And guess what? People healed. People came to me and said, "My life is better, I feel better." I felt better. Most of my day is spent talking people out of surgery, not into surgery. And when it's necessary, surgery, medications are good. But they are many times not only not necessary, but harmful. So this is the philosophy that began developing in our group, in our core group at Doctor in the House, and our nurses and therapists and inventors. And philosophy came of treating a patient like a person and giving patients the understanding, the knowing to heal, to utilize that physiology of the body where the body regenerates and repairs itself, to allow them healing. And that is what this channel is about. That is what our discussions are in these audios. What I'd like to share with you in oncoming sessions: how to treat different problems, sleep dysfunction, stress, anxiety, pain, opioid addictions, how to handle daily suffering with less medicine, and many times much less powerful medicine, and in many cases moving on from the medicines as the body heals and we allow that to happen in a gentler, kinder way. So, be your problem sleep, medication issues, anxiety, orthopedic pain, back pain, arm pain, neck pain, high blood pressure, high cholesterol. We will cover all of these things because when you utilize your body's natural resources, there are always alternative ways. Sometimes to be used with the standard medical system, and sometimes to say no. No to things that are offered when you understand that the complications and the downsides could be worse than what you have already. So I'd appreciate and love to follow with you, to hear from you, hear your thoughts on this. And as we produce regular monthly audios and videos, follow our blogs, follow us on Facebook, on LinkedIn, visit us at our website, docinthehouse.com, and share our journey, share my journey, which I'd like to share with you. A journey of a gentler way to heal, a happier way to live, and a long, happy, healthy life.